So Jason Farrell has been at the heart of investigating the issue of Primados, which was a drug that I've referred to, a hormone pregnancy testing drug that was issued in the very late 50s and available until the mid-70s. Jason Farrell of Sky News has produced and done some investigative work that has supported the claims of campaigners that as a result of being given the Primodos drugs, that they have given birth to children with some hugely serious defects, limb damage, spinal damage, missing joints, vision impairment, and more. And the campaign, led by the residents, has been led by the mothers, has been active for decades, quite simply decades. But through the work of Jason Farrell, it's raised the profile, raised the attention. Prime ministers have been talking about it, conducting reviews. And in fact, this Wednesday, we expect publication of another report on the issue. And I'm really pleased that Jason Farrell from Sky News is here to talk to us about his take on what's been going on. Jason, hello, good afternoon to you.
Good afternoon, Nick.
And thank you very much for joining us. I can tell you, we announced that I'd be talking about this only 25 minutes ago, and already our phones are ringing with people who have been affected by this hormone pregnancy test that was issued in the late 60s, early 70s. Can you tell us a little bit about it and your involvement?
Yes, so the drug was put on the market in 1959, and it was really went on initially as a regulation for periods. So if a woman's period hadn't come, it helped regulate it. And then what they realized was that it could potentially be used as a pregnancy test. Because back in the day, they used, believe it or not, they would actually take a urine sample and inject it into a toad in laboratories in order to see whether someone was pregnant. So this seemed like quite a big breakthrough, that you could take a pill and it would essentially, if you weren't pregnant, then you wouldn't have your period. If you weren't pregnant, then you would have your period. But if you were pregnant, then your period wouldn't come after taking this pill, and you would supposedly go on and have a normal pregnancy. But the idea that these hormones were very, very high quantities of synthetic hormones could potentially damage the child in that crucial moment of development in the early stages of pregnancy when you're taking that pregnancy test, that started to develop in the late 60s. Someone called Isabel Gao, who was a pediatrician, who found out that there was a higher proportion of children born with spina bifida issues if their mothers had taken this drug. And that was the early alarm bell. There were then other alarm bells. The company themselves hired a statistician to look at whether there were higher incidents of malformations in the general population in correlation with the sales of the drug, and discovered that there were. They then had a study by the Royal College of GPs that came out in 1969, which again appeared to suggest a link between malformations and the drug. And at this point, it lost its license to be used in the 1970s, to be used as a pregnancy test, but actually that seemed to go unnoticed by GPs. So GPs continued to hand out this drug in the early 70s, and it actually became higher sales in 1971, 1972 to any previous time. It's thought that about 1.5 million women actually took this drug, and not all of them would have used it as a pregnancy test. Not all of them would have been pregnant at the time that they took it. But it is known that a high number of women who took this drug did end up having children with malformations. And this was discovered again in a study in 1975. Which was published, eventually published, and it led to a warning being placed on the packet that this should not be taken during pregnancy. And then the regulator at the time, 2 years later, having looked at the study more closely, said there's a confirmed association between the drug and malformations.
And yet now, if I understand you, sorry to interrupt you, even after that time, the government and the regulators are saying there's no evidence of a causal link.
Yes, and there's a couple of problems with this. So I mean, the first thing is that it all looked as if there was an association and the regulators took it off the market, albeit 8 years later than they should have done, at least 8 years later than they potentially should have done. But at the same time, there was a legal challenge by the families in 1982, which fell through. And they didn't have the strength of evidence. There were enough experts represented by the drugs company to say that there wasn't an association compared to the number of people who they had saying that there was an association. And it was felt at the time by the lawyers that they wouldn't have a strong enough case against the manufacturer. So this whole thing went very, very quiet for a number of years. And I think the difficulty is that there have been since this came to light, and we sort of found new documentation and new evidence around this over the last I've been looking at this since 2011, and slowly certain things have come out. For example, one of the big breakthroughs I think came in 2017 when we put out a documentary which showed that one of the regulators had actually found a 5-to-1 risk of the drug causing malformations to women who took the drug to their babies, and had warned the drugs company about this, but had said later that they had actually destroyed the documents on which the study was based, in order, specifically saying that they had done this in order to frustrate claims being made against the company.
And this was a British regulator?
This was a British regulator who clearly had quite, I would say, too close an association with the manufacturer. And all the people who I've spoken to within the industry say the way in which he behaved appears to have been, unethical, and that it was his duty to protect patients, to protect British mothers who were taking these drugs, and it seems as if he acted in a way that protected the manufacturer of this drug.
And Jason, what has prompted this review that Baroness Cumberledge is due to publish? Was this as a result of the Prime Minister's intervention, the then Prime Minister's intervention, Theresa May?
It is very much. And I think Theresa May actually should be congratulated on calling this review, because there was a review published in 2017 into the science behind this, in which, as you said in your introduction, found that there wasn't enough evidence to show an association. However, there were a number of issues that people had with that review. One being around the way in which some of the wording of the documentation of that, the conclusions of that review, were actually changed between the drafting of it and the final publication. We got hold of a draft copy of it, which had slightly different wording, which many people felt was significant. Some graphs were missing. Certain things, people said the conclusions didn't quite match what appeared in the body of the text. And there were questions about it, and there was there's a lot of support from MPs on this, and they are to be congratulated as well. They brought this up the very next day in Parliament. I think since then there has been the publishing of a study into fish, the first study of its kind in many, many years, which appears to show that the drug has the potential to cause deformations to fish embryos, and they obviously share qualities with human beings. So, for example, if the fin of a fish is damaged, as it was in the studies that they were done, it would suggest that it has the potential to damage the limbs of human beings. The other thing that happened, which was very, very significant, perhaps the most significant thing that's happened in decades, is a group of experts in Oxford, Professor Carl Hennigan and Jeffrey Aronson, did what's called a meta-analysis. And they took all the studies that have been done on this drug, and gave them, quantified their significance, be that the relative amount of cases in each study, and so on and so forth. And they did what's called a meta-analysis, where they pull all the studies together and say, is there a correlation if you put all the data together? And they discovered that there was. Their conclusion was the opposite of the conclusions of the expert working group in 2017, who said there wasn't association. Their conclusion was that there was an association. So I think that was really, the finality of it, that there was a decision. There needs to be another look at this, and not necessarily at just the science. I think the big question here is, isn't so much can you prove one way or another whether this drug caused malformations? The only way to really realistically do that would be to put it back on the market and give it to women and see what happens. And there's just no way you can do that. The last time that was being done was back in 1977, right? 1978, it was taken off the market. Now, in 1977, the regulator said there is an association. What research has been done on the drug since then? Not a lot, because it hasn't been on the market in that way. The only studies we've really had is this, the really important ones. This is one from Neil Vargason on the fish study, which I mentioned, and Hennigan pulling all these studies together. So, I think it's really important then that they don't necessarily try and answer that question about, can we conclusively prove that this drug caused malformation? The big question is, was there enough concern that if you were to give this drug to a woman, there was a risk that they could have a malformed baby? And if there was that risk, when was that risk apparent? How soon were those alarm bells ringing? And the answer, it would seem to be, was as early as 1967. And then the next question is, why was it left on the market for 10 years?
And will the report address those issues that we're due to see? I think we're due to see later this week. And I think also you have a program coming out on it, do you?
So we will be all across this. I mean, there's obviously huge news in the country with coronavirus and everything else happening at the moment. And there's a spring statement on Wednesday. But for me, this is a huge, huge story on Wednesday, is when this report comes out. Baroness Cumberledge and her team have been looking at how this has been regulated. And I think asking the big questions that needed to be asked right from the start. Which is, was this drug regulated properly? Was the first priority of the regulator to protect patients, and so that they don't have to live with the uncertainty of not knowing whether their malformations were caused by this drug or not, because they're the ones that have had to live with this. I've met dozens of people who feel that they've been affected by this drug, and they're the ones whose whole lives have had to live with the uncertainty. The benefit of the doubt has always been to the manufacturer, to the regulator, and I hope that this will be properly looked at by. I having given evidence to the review team and having seen the evidence being given and watched it on videos, I think they have taken their job very seriously. So I'm very interested to see what happens on Wednesday. I think it'll be a big day.
Well, Jason, we're going to be talking to some of those people, judging by our phone lines, and congratulations on some amazing investigative journalism. Sometimes journalism gets a bad press, particularly these days. This is extraordinary work by you and Sky News, and thank you very much for joining us.